Hello and welcome to TV Studio 2, where we are following how sustainable energy can help the EU meet both its development and its climate goals. I'm Siobhan Hall and I am your guide for the rest of today. We have a packed programme ahead of us with senior policymakers to young entrepreneurs speaking over 6 very different sessions. It's going to be very interesting. We're looking at key themes. These are the EU's energy priorities for sustainable development, and they include access to energy, renewable energies, energy efficiency, and cutting greenhouse gas emissions to protect the climate. So this is all about improving people's lives and protecting the climate. But it's also about the wider development goals, things like promoting gender equality, empowering young people, and fighting inequality across societies and across regions. So using sustainable energy in public health projects is one of the ways where we can achieve many of these goals, and this is the topic for our first session. It's a high-level panel, and we have speakers from the World Health Organization, from the United Nations, from the International Renewable Energy Agency, and also from one of this year's European Development Day's Young Leaders, who's talking about his work in Nigeria. So the topic is going to be focused on access to clean energy, in particularly clean energy for cooking, which is a key issue for air pollution for very vulnerable people like women and children who are predominantly affected by this, and also about bringing electricity to hospitals and clinics to improve healthcare opportunities for the most vulnerable. So all that is going to need renewable energy, and where will it come from and how will it get financing? That is the topic of our lab debate, which is at 4:20 Brussels time or 2:20 Universal time. We will have speakers from the Economic Commission of Africa and the European Investment Bank talking about how African economies can build back sustainably by leveraging political support and private financing for renewable power generation. We are going to continue the African focus in a panel debate on links between water, energy and food. That's at 5:20 Brussels time or 3:20 Universal time. And that's going to look at how to help millions of small farmers access new technology, such as solar-powered irrigation, and make it a viable business model. So that panel will look at options such as microfinancing and sharing economy approach to expensive assets, a bit like we have with car sharing and bike sharing here in Brussels. The idea is that these are tested in real-life environments, and that gives valuable feedback on what works and what doesn't. The final African session will be the interview with the European Development Day's young leader I mentioned earlier. That is Chibuna Ogbonna, and he is on a mission to bring solar power to hospitals and clinics in Nigeria and beyond. And you can follow that interview live at 6:10 in Brussels or at 4:10 Universal time. We also have 2 interviews focused on energy efficiency initiatives, and they are focused in countries to the east of Europe, so away from Africa this time. We have a topic on the Energy Efficiency Fund of Ukraine, which is all about improving the lives of ordinary Ukrainians. That's at 4 p.m. And we also have a project which is working with local authorities in 6 countries, from Azerbaijan to Belarus and others, to increase energy efficiency in buildings. So that will be at 5:10 Brussels time or 3:10 Universal time. So if you miss any of the sessions, don't worry, they're all going to be recorded. And you'll also be able to chat to speakers in the Global Village section on the website. So I was talking earlier about our first session. It's going to look at public health issues, about air pollution, about how sustainable energy can make a difference to the everyday lives of ordinary people, but particularly women and children, as they tend to be the ones who are most affected by lack of energy to households and hospitals. Like I said, all the sessions will be recorded. You can chat to many of the speakers and organizations you're going to hear from today at the Global Village section on the EDD website. Many of them have stands, and it's going to be a really fascinating afternoon. So we are going now over to the first session, which is on public health and sustainable energy in just from now. Okay.
Can you hear me? Hello, everyone. Good afternoon. Can you hear me? Thank you very much. It is my pleasure to be with you at this occasion. It's a privilege for us as WHO to be represented here, and we are very, very happy to have the opportunity to, in my case, to be your facilitator, your moderator. My name is Maria Neira, and I'm the director of the Department of Environmental, Climate Change and Health at the World Health Organization. And with your permission, and I hope you will give it to me because there are no other options, I will be your moderator, your facilitator this afternoon. And believe me, it will be a very, very interesting session. This event will be a moderated panel, but very active and with very high-level participants that I'm sure you will be enjoying. But allow me first to thank the co-organizers of this event, EVOS, Energia, UNDP, UNDESA, and the high-level dialogue on energy and health, as well as, of course, we thank very much the EDD organizers for all the support around this session. The idea is to make sure that everybody is aware that if we want to protect people's health, if we want to tackle the causes of climate change, if we want to tackle the causes of air pollution, if we want to obtain benefits from an economic and social point of view, we need to accelerate access to clean sources of energy for people around the world. And I'm sure. Sorry? Okay. Sorry, I had a little interruption from the IT group. I was saying that it is now my pleasure to then give the opportunity to provide the opening remarks, the little remarks to our Director General, Dr. Tedros from the World Health Organization. We have a video message from him. Please, Dr. Tedros. Can I have the video message, please?
Excellencies, distinguished panelists, dear colleagues and friends, the link between health, clean energy, and climate change has never been clearer. Just last week, WHO hosted the first meeting of the high-level coalition on health and energy with the aim of accelerating access to clean and sustainable energy to protect health. Leaders from many countries and sectors came together to champion energy access as a public health issue and endorse the strategic roadmap on health and energy, which identifies clear priority actions. First, dramatically increasing public-private investments in electrifying healthcare facilities and in clean cooking. Second, providing the necessary human and financial resources to design and implement clean energy plans and sustainable delivery models that promote and protect health and are tailored to the needs of the health sector and households. And third, developing tailored policy and financing schemes to unlock the potential of clean and sustainable energy solutions and to address health sector needs. I'm sure today you will identify more concrete measures to promote health and well-being through clean and sustainable energy. WHO stands ready to work with you all for a healthier, safer, fairer, and more sustainable future. I thank you.
Thank you. Thank you very much, Dr. Tedros. As he mentioned it, only 1 week ago, we have a very high-level meeting of the coalition of partners to make sure that we accelerate access to clean sources of energy at the household level, and of course, the electrification of the healthcare facilities. Many of the people who has been attending this meeting, they are now trying to pass and disseminate this message, which is critically important on access to clean sources of energy for as I say, tackling the causes of climate change. tackling air pollution and generating more health for our people. And in that sense, it's a great pleasure now to introduce Mr. Achim Steiner. He is the administrator of the UNDP, the United Nations Development Program, and is, of course, a HEPA, the Health and Energy Platform for Action co-convener and member of the High-Level Coalition on Health and Energy. So Mr. Steiner not only is the administrator of UNDP, he has a very long experience, and we have the pleasure as well to have him as the executive director of UNEP, the United Nations Environmental Program. Among many other roles, he's as well one of the co-chairs of the high-level dialogue on energy of the UN. And Achim, if you are with us, let me ask you the first question. We all know that UNDP is always very proud of working on different parts of the world, really at the ground level. With all the experience that you have accumulated, that UNDP have accumulated on this type of country projects, what will you consider the barriers and the key priorities for accelerating or for scaling up investments on clean energy solutions for health and for climate? Achim, over to you. Okay, I'm afraid. Okay, let's be prepared to adapt. This is the language of the climate change community, so I'm sure we are all ready to be adaptable and to mitigate. So in order to mitigate and to adapt in this case, can I go over to you, Francesco La Camera? Mr. Francesco La Camera is the executive director of the IRENA, the International Agency on Renewable Energy. And not only that, he has behind him more than 30 years experience on climate change and sustainable development and energy issues. And I'm sure he can share with us what are the key issues, the key investments we need to do, the role that the renewable energy can play, and what are the solutions that are available and we need to tap on it. Francesco La Camera, over to you, please.
So thank you, Maria. It's really a great pleasure to have the chance to be with you in this session. And hopefully that Achim can join later. It will be also a pleasure to have the chance to be together also with him. And let me thank for the invitation and the opportunity to talk with you today. So we are all aware that 2/3 of the global greenhouse emissions come from the use of the fossil fuel. So this is the biggest contributor to the climate change and the air pollution. I remember that already when we met the first or second time, Maria started to teach me about the impact of the pollution and on the health. So that is a impressive number of 7 million premature deaths that occur every year caused by air pollution. I remember when you gave me this number in Abu Dhabi when I'm preparing the climate summit, and then now still we have around 4 million of these deaths that are caused by the indoor pollution. And there's also another dramatic number that we have to face, and how urgent is to provide with a modern energy for better breathing and also for the cooking. So this situation, as this number, as we know, Maria, they are simply not acceptable, and especially at our time when a solution exists to come from the dramatic situation of today. So renewable, as well as a decentralized solution based on modern bioenergy and electric cooking are important part of the puzzle to address these two problems of the air pollution and climate change. It's crystal clear that the transition towards renewables offer a sustainable, lasting solution to mitigate the adverse impacts of climate change, while improving the quality of the air, so also impacting heavily on the health and the well-being and livelihood of the people. And what is important to notice and to always to have in mind that today is not just a question to mitigate climate change and offer a solution for the air pollution. The fact is also that today renewables are the most competitive with fossil fuel in most parts of the world. We have a publication that is coming every year around June, and our latest report that will be launched in a few days on cost show that the share of renewable energy that achieve costs lower than the most competitive fossil fuel option doubled in 2020. So in this dramatic year, it's evident how renewable energy has become more and more competitive. Just to give some number, 162 gigawatts, that means the 62% of total renewable power generation that was added last year at lower cost than the cheapest new fossil fuel option. So it's not just a question of fighting climate change, getting a better environment, go for an ethical solution. It's also an economic, the best economic option. But we need to go beyond just the power sector and do more, as come from your question, Maria. So the end-use sectors like heating and cooling, industry and transport might be rapidly decarbonized as well. One example is geothermal energy that still remain underutilized in meeting the growing demand for heating and cooling. As you know, we have this global geothermal alliance, and we are supporting our member in enhancing the use of geothermal energy for various end use, such as power generation. But in this case, it's important to mention district heating and cooling and food system. It is important to understand that the energy transition is not just a change of fuel sources. It is a systematic change in the way we produce and we distribute and consume energy. So we need innovative thinking to conceive policies, regulation, and business model that can facilitate this transition, including also new market design, business models, and novel way to operate energy system. So technologies are not enough. We need also to put in place policy, change the structure market to make this transition be more rapid. We need countries to define a clear strategy to meet the ambitious net zero target. And now I have seen that finally ACIM has joined us, and we are working together in supporting the country in the presentation of their updated and more ambitious NDCs in the way to COP26. And this has to be done to give a clear signal to the market and resulting in an increased public and private investment in innovation for the energy transition. We need policy framework that link efficiency and infrastructure to the deployment of renewable to enable a share of renewable to the energy system. Significant investment in infrastructure are needed in order to build modern and resilient grids, fast charging solution for electric vehicles, and in hydrogen grid. All of this will act as major enabler. This infrastructure investment need to come ahead of the demand and will require carefully coordinating planning and target infrastructure and target incentives. Preliminary funding of our soon-to-be published World Energy Transition Outlook show that to achieve 1.5 Celsius pathway, the global energy transition investment will have to increase by 30% over the planet investment to a total of 131 trillions of US dollar between now and 2050. And this also have to include a switch from investment in the traditional sources to the new one. And what's happening is this tragedy of the pandemic is give, as Hakim once designed, as a once opportunity in life to use this opportunity of the public spending, the heavy intervention of the state in the economy as responding to the impact of the pandemic. This is also a chance, an opportunity to accelerate our efforts as a significant amount of money is channeled into recovery measures. It's also presented us with an unprecedented political momentum. We have seen all the declaration coming around, and I'm also happy to notice that finally the vision of our agency on a future energy system that is largely based on renewables, complemented by green hydrogen and modern bioenergy, that was just a dream a few years ago, or a niche option, judged for someone now as becoming mainstream, and governments and all the other are going in this direction. Thank you, Maria. Back to you.
Thank you. Thank you so much, Francesco. And as I mentioned before, Francesco La Camera is the Director General of the International Agency of Renewable Energy. And I'm very pleased to hear that he still remembers all the numbers about how lack of access to clean sources of energy was negatively affecting our health. There is another very convinced person in the room, our friend Achim Steiner. He is very convinced from the beginning. He's one of the converted from the beginning on understanding how environmental risk factors were affecting our health. Dear Achim Steiner, he is the administrator of UNDP. And Achim, I did already a very formal presentation of you, so allow me now to be very informal. We are calling each other by name, if you don't mind. And I need to bring you to the conversation following up of what Francesco was saying, that the solutions are there, that this is quoting you saying that this is an opportunity on a lifetime. What's happened? I mean, UNDP has many country projects. You are at the ground level. Why are the key obstacles for not having more investments on clean energy to protect climate and to protect health? When it's so obvious, what are the obstacles for scaling up this investment on clean energy? Achim, over to you.
Can you hear me okay?
Yes,
Perfect.
We can hear you very well.
Hello to my distinguished fellow panelists. I heard most of what Francesco said. Sorry for being a little bit late. I wasn't late, but as usual, sometimes these platforms present us with new challenges. It's also a great pleasure to join you and these European Development Days, because I actually believe that Europe, in its outlook, but also in its commitment financially to itself, but also to its engagement internationally, has an enormous role to play precisely in the intersection of these two topics that you are moderating us through this morning, Maria, or this afternoon where you are, health and energy. And let me begin by saying that, we're actually not starting from zero at all. In fact, Lou Jimin, Damilola, and I have just published an op-ed in which we basically say that the energy revolution is here. And Francesco just spoke about the numbers, the cost per kilowatt hour. I mean, wherever you look, the journey of moving us from an energy system and matrix, first of all, that you in the WHO a few years ago began reminding us actually costs 7 million lives a year through premature deaths, indoor and outdoor air pollution, a significant part of which is related to the use of fossil fuels. So the price for maintaining that energy matrix of the 20th and 19th century certainly is not one that we either would like to do, nor are we bound to do or compelled to do, because the alternatives are here. And I think what is interesting when we talk about the health and energy sector is, first of all, there is a vast potential there. And yet the question is, so why isn't it just happening? Well, the first reason is, I think one that also led us to adopt the 2030 agenda and the SDGs. A health ministry thinks about its health infrastructure to deliver health services. It is not the perspective of the energy ministry of how to get power and electricity to infrastructure. So first of all, governments themselves, as Francesco alluded to, need to look for policy and systemic approaches that allow us to combine the delivery of a health service with also providing power and electricity to the health infrastructure. It's something that, in fact, in UNDP, since 2017, we have been experimenting with the Global Solar for Health program, which you know very well, and basically used it to connect over 900 health centers and storage facilities in 12 countries already with solar photovoltaic installations. And, you know, it fits so well because on the one hand, it deals with a major challenge, an Achilles heel in any health center that is not assured of a power supply. The cooling chain, the hours in which it can operate, the instruments it can use, you know, is a basic health rationale. But it's also the ability to recognize that many of these health centers have a lot to do with those who are in danger of being left behind. They are in remote areas. They are perhaps in the poorest parts of the city. And often the renewable energy, the off-grid infrastructure with photovoltaic panels, to use one example, is actually a shortcut to providing access to electricity. So I think it is in that reconceptualization of two parallel problems, two parallel ministries, two parallel policies, that perhaps the greatest shortcut to enabling something to happen lies. Secondly, the deployment of technology. We obviously are continuously dealing with a improvement and enhancement of off-grid technologies, renewable energy technologies, but also their cost per kilowatt hour. So the operating cost becomes less and less of an issue because actually once you've installed it, the health ministry has less of a recurrent cost. So the real issue then becomes one of financing. And this is where we have struggled the most, because to be able to provide a electricity generating infrastructure, you need investment capital. Health ministries in many poorer countries are struggling already with just maintaining the budgets for staff and for basic medicines that are supplied. So we need to find new models. And that's where in UNDP, we've also been trying to work on how it is we can address the insufficient public, private, domestic, and international financing for energy capital costs, be it in terms of a consolidated program, maybe for 1,000 health centers, be it in terms of maybe 1,000 megawatts in terms of national energy capacity and electricity generating capacity. So we need to find ways in which we can address this financing challenge, because otherwise the economic viability is there, the imperative of having it available is unquestionable, and its functionality is proven. And these 900 health centers are a perfect example of how this works. But we need to find new models, including a new model that is perhaps based on an energy as a service approach, where we're able to draw in the private sector as a service provider. Maybe that can, you know, put the capital up front for the installation and then recover it through the payment of electricity bills. I mean, it's something that's done millions of times a day across the world. Why not also bring it into the economy of, let's say, those who are at the last mile of access to energy? Finally, let me also say that it's not just about electricity, it is also about clean cooking. We still have this challenge that too many, and there are millions and millions of women in particular, do not have alternatives to being able to, or to using biomass. You have been at the forefront again of trying to draw the attention of what the health impacts are of that. Here is another challenge of trying to combine health and energy. And I end by saying that in the midst of this pandemic, with the challenge of vaccinations now, not only from an equity point of view, but also from a vaccine systems delivery infrastructure, cold chain perspective, this is a pivotal moment. So when Francesco, you know, quotes me as saying this is a once in a lifetime moment, I actually think it truly is a generational moment. We can try and address these obvious opportunities, first of all, to address access to energy. We can do it with a perspective of those who are most vulnerable, least able to do it out of their own ability. And government can play a critical role if it can also mobilize private sector support. And that is, I think, some of the lessons that we have learned on trying to address what is a fantastic opportunity in the logic of the SDGs. Look at how you can reach the poorest, look at how you can improve health services, access to electricity. All of this can come together. Back to you.
Thank you, Achim. It seems to me that we are just accumulating good arguments and positive and win-win. So the list now opportunities is growing. We need to make sure that this revolution, the energy revolution you were talking about, is happening. And we are happy as WHO to contribute with a healthy argument for that. So we will have a healthy energy revolution with your permission. I'm very pleased to have now a young leader. Not that Francesco or Achim or myself, we are not young enough, but this is a young leader from Africa. His name is Chibuna Ogana, and he's from Nigeria. He's a very stimulating and an entrepreneur. He created his own company. He's co-founder, chief executive officer at, it's called Kiru Energy LLC, and he has been working on sustainable energy. I'm sure that as a young leader in Africa, you can tell us what's your perspective. I mean, what are the insights? What have you learned? And how are you prepared to go around the barriers that I'm sure, and there are many barriers in Africa at the moment, but I'm sure you are very creative as well on going around those. Can you share those experiences with us? Chibuma, over to you.
Okay, thank you very much, Maria, for the opportunity. I also want to thank Mr. Francesco La Camera for the opportunity to be here as well, and to the World Health Organization for selecting me to represent my country here. So in terms of my perspective and insights working in renewable energy or sustainable energy in Africa as an entrepreneur, I've understood that there are so many opportunities in Africa, especially when it comes to sustainable energy. Only in Nigeria, you have that over 80 million people are out of electricity, and this is a huge market opportunity. Also, we find that sustainable energy has helped to create jobs, has helped to improve lives, even in fighting the COVID-19 pandemic, as it was used to combat COVID-19 through the installation of solar panels and battery systems for the isolation centers during the COVID-19 pandemic last year. So all this culminates into understanding that sustainable energy helps to mitigate climate change and also to solve so many socio-economic challenges. So some of the barriers we have also experienced working in here in Nigeria and Africa is due to unstable regulatory policies. And these unstable regulatory policies sometimes scare investors away, and for an African entrepreneur, one of the major things we would love to have or love to see in terms of support is an environment that helps to ease of doing business. We want an environment that will be suitable for doing business, as well as incentives for sustainable energy entrepreneurs and other entrepreneurs who are involved in the climate protection industry as well. Thank you.
Thank you. I hope you are gaining momentum and you are gaining more and more people, young people like you and young entrepreneurs to facilitate all of this acceleration and scale up. As you said, there are plenty of opportunities, so I don't see why we cannot jump on it. Let me go back to you, Francesco. I'm sure you are very much convinced of the importance of the intersectoriality, how you are linking the access to renewable sources of energy to other SDGs. And so how do you think this renewable energy can support the achievement of those development goals? And in particular, maybe since we have a joint project on that, on the electrification of healthcare facilities. Francesco, over to you.
Thanks, Maria. As we just say that the transition, the energy transition, is not just a change of fuels, but is a different way to produce, distribute, and consume energy. And this means that adopting a nexus approach is absolutely at the heart of the energy transition itself. So this would require bringing together the energy community and all the actors from other priority areas. And this is evident, as you mentioned, concerning healthcare, but also on food and agriculture, livelihood, water, and sanitation. All these sectors are to be brought together into the approach or into the new energy in the energy transition. And so it's important for forging effective partnership fostering intersectoral cooperation between different actors. This is absolutely paramount if we want to maximize the benefits that the use of renewable energy bring in the context of achieving the SDG and ensuring also a just and inclusive energy transition. And ARENA has been actually promoting such an approach. So this is the reason we are very close and working together, Maria, because we think that health and the energy transition has to go together. As we have working together with the FAO, what we call about the Nexus Energy Foods, and we are also working with other regional institutions to make this this approach really the one in putting in operational the energy transition. Such coordination is essential, whether it is for planning the economic stimulus package or linking the short-term recovery. That is very important. We link the short-term recovery with the medium and long-term goals of the sustainable development and the Paris Agreement goal. So we have 2030, 2050 that are the year that guide our action today. And the socio-economic of this nexus approach of the energy transition is very, very, very clear. We have many reports where we come with a number that give no doubt on how positive is going for the energy transition. We see that already in the post-pandemic, in the 3 years starting from now, if we go for invest what we need in terms of as a need for the energy transition, we can have more jobs, 3 times more jobs of investing in traditional fossil fuel, and the jobs in the energy sector may triple. So we have around 11.5 million. This will become 30 million in 2030. So as Chinuma says, it's very evident that there is an advantage on going through to renewables. And this can also add in the 3 years already 5.5 million. That is a very important number. And the transition will bring a massive improvement in people's well-being, with health and education expected to have the strongest positive impacts. Renewables, particularly through decentralized solutions, is also key in fostering energy access for basic services. So what we are talking before, including the healthcare facilities. Such solution can cost-effectively supply the critical power needed in rural communities for the health center, facilitate the provision of clean water, support agriculture and other productive sectors. Specifically in healthcare, as you asked about this, decentralized renewable energy solutions are the most cost-effective means to provide electricity in rural health clinics operating in the last mile. As of today, close to 1 billion people are still being treated in facilities that have unreliable energy power sources. Electrifying this facility can provide energy for lighting, running of essential medical appliances, and maintaining the necessary level of hygiene. ARENA is actively working with its member partners to promote the use of renewable energy-based solutions in rural healthcare. We are carrying our country needs assessment and provide a recommendation for creating an enabling ecosystem for electrification of health facilities through renewables. You know about our work, our ongoing work in Burkina Faso, in cooperation with both the energy and the health minister in the country. And ARENA will expand this exercise to other countries in the sub-Saharan Africa during this year. Yeah, I'm looking forward to meet again with my friends Akim and to make.
I think they want to test again my skills as somebody who can improvise, because we have lost Francesco La Camera, but it's fine, we can do it. In fact, Achim, there is something I wanted to ask you, because among the many positions you have and difficult ones, you are as well, in addition to the administrator of UNDP, you are the co-chair of the UN Energy and of the high-level dialogue of energy that will take place in September. And from your privileged point of view, you know that we are trying to accelerate collaboration among different partners and actors. But how do you think we should do? How we should prioritize this collaboration, and what are we missing, and how can we accelerate that? Achim, over to you.
Well, I think where Francesco just left off is a very good point to begin answering your question. I think it is in both the design approach to investing in these agendas. I think we live in a time where much of the 20th century was sort of driven by particular solutions, almost a sense of silver bullets, being able to accelerate development. I think much of what we see happening around us today, first of all, points to enormous complexity, secondly, uncertainty, and thirdly, we need to also be very conscious of the fact that in a world with today 7.5 billion people, when we invest in something, we need to invest for a lot of people. Remember, 300 years ago, we were just 1 billion people on this planet. So everything, whether it's access to food, access to electricity, access to health services, we are talking about 7.5 billion people. So if we look forward, obviously climate change is now an imperative on which we have to act. So decarbonization becomes a major driver. But this is the beauty, again, as I alluded to earlier on, of the Sustainable Development Goals. We have SDG 7 this year. We are going to have a high-level dialogue on energy later this year. But it is precisely to demonstrate that you can talk about opportunities from different vantage points if you design well. So, a project can address decarbonization. At the same time, I saw this in Sudan, where I visited, a year and a half ago, when the revolution was basically beginning to open up entirely new opportunities. How can you help a country like Sudan that is economically under great distress, with many people in the rural areas having no access to electricity, bring clean power, renewable energy, off-grid, help them in a sense to use electrification as a way of driving development, but also establish a renewable energy economy that doesn't take Sudan down the pathway of a 20th century fossil fuel-based economy. It has immediate health impacts. It creates new jobs. And I think it is that rethought frame of designing policy, but also investment propositions. And then we need partnerships. UNDP works very closely with IRENA, with WHO, with UNEP, in trying to understand how can we help countries to meet both a decarbonization, cleaner energy objective, while at the same time creating access to electricity for the 700, 800 million people who still don't have it. And herein lies a real challenge of our time. We need to basically provide an additional 2.5 to 3 billion people with access to electricity by the year 2050, because that's where our world population will be. So that's a very significant number of additional electricity consumers. Add to that the fact that we are transitioning onto an increasingly electricity-based energy platform for mobility, for buildings, for heating, etc. That means we have to produce a lot more electricity. So unless we can combine these different drivers and therefore generate the economies of scale, but also the investment capital, we're going to fail on all fronts. And I think this is really at the heart of where development thinking has to reinvent itself right now. And it has to begin where maybe Chubuna will speak to in a moment, because both the entrepreneurial and the local reality are the best starting points from which to design system responses. Then we can bring in technology, then we can bring in financing. But I think if we don't start from where people would actually design their system in a certain way, and then create the conditions that allow them to succeed, I think we will continue to fail. And look, there are very rich fossil fuel economies in the world that to this day have not provided sometimes half of their population with even access to electricity after decades of exploiting their fossil fuel resources. So simply having the potential to provide doesn't translate into actually delivering power and infrastructure. And I think that is where our greatest opportunity lies in the years ahead. Back to you.
Thank you, Achim. Sometimes it's difficult to understand why decisions are not taken quicker and faster and on a more ambitious way when we have all the benefits that we're describing. Francesco, you were interrupted. Maybe you wanted to finish what you were saying, or you feel that you were giving us enough insights about the nexus between renewable energy and SDGs.
I don't know if you can hear me now. I hope so.
Yes,
and
we can.
I was when I lost the connection. I was
It's not me,
talking about.
Francesco. It was just the technology. It was not me. It was very interesting what you were saying. So we didn't cut.
Yeah. But the connection was lost. I was talking about the work that we are doing on connecting renewables with health. And we were talking about that we are actively working with our members and partners to promote the use of renewable energy-based solution in rural healthcare. One good example is that is this one where we are carrying out country needs and assessment and provide recommendation for creating and enabling ecosystem for electrification of health facilities through renewables. This good example is coming from Burkina Faso, where we are working with both ministries. That is sometimes not so easy. So the Ministry for Energy and Minister from Health, and we want to expand this pilot study, and that is giving good results also to the other neighboring sub-Saharan Africa during this year. And this health benefit and renewable energy solution, and yeah, I mentioned the fact that we have to meet with Achim to find our common strategies to do this kind of job better than we did in the past, if it's possible. So the health benefit and renewable energy solution can be extended, as all we agree on the clean cooking solution, where we have millions of people that rely on traditional biomass and charcoal to prepare their food. And also, Achim gave us the perspective from now to 2050, because the population is growing. So we have to think about not the number of today, but the number of tomorrow. That demand has to be satisfied. So it's important to avoid all the health problems that we have all aware of, like the respiratory disease and pneumonia and asthma and others. Also, renewable energy solutions have the potential to significantly add value in the agri-food chains and reduce losses, thereby possibly contributing to food security. I remember when I was working in my ministry, in my previous activity, that we funded many possibilities in agriculture for the use of electric renewable plants from renewable energy, and this got very important good results. It is possible then to limit the use of fossil fuel and food treatment. This is absolutely possible. And this could be done through the use of renewable-based irrigation, as I was saying, and food processing. Decentralized renewable energy can also increase access to information through the provision of mobile phone services and the internet in remote setting, which allow food producers to tailor their activity to the needs of the market. And the word of Chimuna and then what has been taken on board from Achim give the way to proceed. The centralized renewable energy solution can be deployed in refuge setting as well as for peacekeeping operation. And Arena is working in both areas. And these are often reliant on fossil fuels. Renewables can ensure basic lighting as well as the operation of essential service, while bringing about massive saving for the organization running refuge settlement and reducing the carbon footprint of peacekeeping operation. And 1 hour after the end of our meeting today, Maria, I will go to sign this memorandum with UNDOS, especially for this kind of activity. There is the interest of many countries to support this work. Allow me to conclude that by saying that energy is central to the achievement of all the SDGs. So the fight of climate change is a central issue in getting the job done. Without a functioning and clean and sustainable energy system, there is no eradication of poverty, no end of hunger, no guarantee of protection for biodiversity, of environment, or health. And this will be only possible through cooperation among countries and institutions. And in our forthcoming full world energy transition outlook, we will give the number of the financial resource needed in terms of cooperation, and also trying to distinguish the different flow this cooperation has to be fit. So only through cooperation among countries and institutions we can create the enabling framework that will deliver on this objective. So let's not forget that the coming 10 years will be the years of the implementation of Sustainable Development Goals, the years where we will build the world prosperity of the future, and the decades where we know if it will be possible for us to achieve the Paris Agreement. So this decade is decisive. Thank you very much. Back to you, Maria.
Thank you, Francesco. Definitely, we need to accelerate, and Glasgow COP26 has to be one of these places where we need to accelerate. We are not missing strong arguments for us in WHO. As you know, we are doing our best to not only to collaborate with all of you, and we appreciate this collaboration, but making sure that the health argument is very well recognized and accepted, and seeing that we can save many, many lives if we now invest on access to clean sources of energy. That I suppose that after the pandemic and the terror that this has created among people to have their own health at risk, I hope that by this type of messages we can reduce our vulnerability as human beings, and our health will be more protected. Let me now go back to the young entrepreneur again. You're working in Africa. You said that there is a market, there is a business, there is a need, but why is this not happening there? Why there are not thousands of entrepreneurs like you? What are the challenges that you are facing in Africa with a young population, with the opportunity to do things from the beginning, learning from the mistakes that in other countries we were making? What are the challenges and barriers that you are facing for not going faster and in a more ambitious way on this access to clean and renewable energy?
Okay, thank you very much, Maria, again for this opportunity. Some of the challenges young entrepreneurs face in Africa, number one is lack of capacity building opportunities, because entrepreneurship is a huge opportunity that needs to be tapped by these young people. But without the right capacity, they cannot actually lead these businesses, and as well as they cannot be able to identify the opportunities in the problems that they see in their environment. So I will say that helping young Africans to access capacity building opportunities will help to increase more entrepreneurs on the continent. Another thing again is the lack of financing. It's very, very difficult for many young Africans to access financing, especially maybe due to their age or due to their experience. Accessing financing for businesses in Africa, you need to have a lot of understanding of business. You need to understand about investments. So I think the major thing that will help young Africans to access more opportunities in entrepreneurship is capacity building. So another thing again, I've also understood based on my work here in Africa, working for health and the intersection between health and energy is through the Lighting Up Nigeria initiative, a project my company launched in October last year as I came back from the Arena Youth Forum, and COVID-19 kept everybody on lockdown. So I talked with my partners and we decided to launch a social impact project, the Lighting Up Nigeria initiative. And on working on ground, one of the challenges we encountered was lack of funding for our project. So we had to use our own personal funds, to facilitate the pilot project for the healthcare community, the healthcare in the community that we are powering with solar energy. So we used our own funding And while we tried to do crowdfunding, it was not really possible for us to get much people to contribute as a result of the economic recession in the country due to COVID-19. But while the project is being delayed a bit, we are still hopeful. We are still applying for grants, and we are still pushing hard to ensure that the project is completed. Like I said, the aim of the Lighting Up Nigeria initiative is to power 10,000 local health care clinics by 2030. 10,000 local healthcare clinics by 2030. And that's a very huge, ambitious goal. But we believe that with more cooperation and partnerships with other sustainable energy companies, we'll be able to achieve that. I would like to also highlight that primary health care is key to achieving universal health care. Without primary health care, we cannot make progress in achieving universal health care. And one of the ways to make primary health care functional is by using sustainable energy to power these primary health clinics. Many of the primary health care clinics in Africa are most times neglected and underfunded. Also, most of the health workers who work in these healthcare facilities do not have the required capacity or the funding, to do what they are supposed to do in the healthcare. Most of them don't have good welfare systems to take care of the healthcare workers. So these are some of the challenges that we have, experienced on ground. Another thing again is that most of the existing healthcare facilities in Nigeria and most parts of sub-Saharan Africa are dilapidating. Most of them are neglected, and as I said, most of them are also underfunded. So prioritizing investments for healthcare clinics using sustainable energy, to drive the electricity access for these healthcare clinics is key. And also it will help to boost both our healthcare in Africa. It also helps to boost employment. It also helps to boost climate protection. And another thing I would want to say is generally that when we have communities who don't have access to primary healthcare, they will become weak links, in the global goal to achieve universal healthcare. So we need to ensure that communities have functional primary healthcare facilities so that we can all achieve universal healthcare. Thank you very much.
Let me ask you a question. Do you think that there is demand? I mean, the users at the healthcare facility, you think that they have a demand, there is a pressure on politicians, or simply they don't see that is their right, or they don't see the need for that? What's your feeling?
Yeah, I think that there is a demand for it, because while we started the first pilot project in Umuahia, Nigeria, the community healthcare facility we visited, the health workers started complaining to us that they barely have light to power, they barely have electricity to power the healthcare facility, especially at night. Most of them use torchlights, or sometimes candlesticks, to offer basic medical services. So this was really disheartening when we heard this. So there is a huge demand for it, and in fact, most of them even wanted us to install the solar panels in their own homes. That is the healthcare workers. So I think there is a huge demand. However, communities need to be empowered, to be able to access sustainable energy. Because sustainable energy for now in Africa is still expensive for many people to afford. And if we are to empower communities with sustainable energy, we need to create incentives for the sustainable energy companies and entrepreneurs to offer very good tariffs, that will support these communities to access clean energy. So I think there is a huge demand, but what we need is more partnerships and international cooperation, to boost investments in sustainable energy for healthcare.
Thank you. A very quick question to you, Ahim, in the last minutes. Do you think that internationally, with all of this high-level dialogue and all the pieces of the puzzle that we need to put together, do you think that the society as such has learned more about the importance of renewable, sustainable sources of energy, and there will be this type of demand and pressure for politicians to take more action? Do you think we have advanced on that, or we are still talking about the planet and something very remote, next generation, and still don't see the connections?
Take the issue of climate change. In the midst of a pandemic, we have seen remarkable commitments emerge that would have been unrealistic to expect just 18 months ago. So why has that happened? Because I think both political leaders, our political establishment in many countries, but also the private sector are sensing that the public is beginning to scrutinize, first of all, the choices that have been made, the choices that are being presented to them. Secondly, let's also give credit to our young people. It is they who have shown the impatience, and it is they who are, in a sense, with far greater clarity, thinking about the choices that need to be made now in order to have a different kind of future 10, 20, 30 years down the line. And I would encourage people to show more impatience. It's not necessarily about getting frustrated or angry. Yes, there is a reason to be frustrated with the inertia. Be clear-eyed, understand that there are vested interests, and they sometimes explain why we are so slow. But then also use the power of public engagement. Whether it is a Fridays for Future, whether it is people who have stepped out onto the streets in other parts of the world demanding that governments change the way they address an issue such as climate change or inequality, justice. People have power. And I think in the way that political choices, economic choices will be made are increasingly going to be a function of public voice. And just to reinforce that, it is no accident that we are seeing some of these issues now migrate into the domain of our judicial system. We are entering into a phase where societies are questioning the decisions being made for us as citizens by going to their constitutional and supreme courts and essentially turning to a justice system to rule on the inaction or inertia. And I think this is a fascinating moment and another evidence of why I think public movements and public voice is changing the conversation.
Thank you, Achim. Believe me, the health professionals, we are getting very, very impatient. I hope that we will mobilize the health professionals and their voices will be very, very strong. We have only 3 minutes to go, and I wanted to ask Francesco for something that I hope we will have stressed enough, but green jobs, Francesco, do you think that renewables will provide more jobs? And because this is sometimes one of the arguments. In WHO, we put it forward this manifesto for a healthy and green recovery, and we says that access to sustainable sources of energy are fundamental for our health, and we will try to provide arguments saying this is not just about protecting people's health, but it's as well about jobs and development and recovering for our economy. So I think you mentioned some figure. Is that correct, that investing on renewable energy will create much more jobs than fossil fuels?
Naturally, Maria, I can assure you that you can believe in the arena numbers. We have been, I think, the first, and we are still the leads in the socioeconomic analysis of the impact of the energy transition. And jobs, for us, is naturally a crucial aspect. It's not the only one relevant from a social point of view, but naturally is one of the most relevant. And we make clear in our agenda, we call it the post-COVID agenda, so in the next 3 years, as if we are able to double our investment into the energy transition, we are going to get 5.5 million additional jobs. We make clear as for every dollar spent, we can have 3 times the number of jobs if we invest in renewable energy.
This is the perfect message to finalize. I have the IT colleagues reminding me that we have to stop. I wanted to tell you how privileged we feel that we have such an incredible panel. Really fantastic. Thank you so much for your commitment, for your leadership. Achim, Francesco, the young entrepreneur, we count on you as well for the future. It's critical for the health of the people as well, what you are doing. We thank you, EDD, EBOS, Energia again, and UNDESA and others for organizing it. And thank you, Achim, for your time. Thank you, Francesco. And thank you, our young leader as well. We count on you for the future. Thank you. Keep pushing. Keep impatient. Thank you very much. Bye. Bye-bye.